Hi there. I'm Dr. Janak Chandrasoma at Sol Snider 2015 in San Francisco. I'm here with Simon Ash.
Yes, hi.
Dr. Simon Ash. Dr. Ash, how many times have you been at Sol Snider?
This is actually my first time to Sol Snider, but I've been attending SOAP meetings for a while.
Oh, great. And how do you think this compares? How do you think this is, how's this conference going so far?
Well, the conference is going very well. I'm actually comparing it directly to the OAA meeting in November in Westminster, and this compares really favorably. It's a lot more sort of educational as opposed to SOAP with the main meaning where it's very much research-based and sometimes above people's heads. This is a great sort of summary for those wanting to learn a little bit more about obstetric anesthesia.
Fantastic. Are you yourself an obstetric anesthesiologist?
When I can be, yes.
And where do you practice?
I'm currently practicing in Canada, but previously out of Dublin at the Rotunda Hospital, which is a 10,000 delivery a year hospital, and prior to that at Chris Hani Baragwanath in South Africa, which is a 30,000 a year delivery hospital.
Okay, so that's 4 different countries that you've told me about. How does obstetric anesthesia change from each of those different countries? Do you find that there's significant differences, or is it across the board relatively similar?
That's a difficult one to answer, because I think in South Africa it's very much based on your practice is limited to the resources that you have. As you go more first world, the less resource poor environment you're in, the more sort of nuances you add to your practice. In South Africa, I wouldn't have used ultrasound as a standard for placing epidurals or for spinals, yet since working in Ireland, it's now become something that I do regularly.
You are so internationally present. Did you bring anything from the other countries that you've practiced to this country and to Canada?
The exposure that I've got is such that I've got the experience to go with it, and I can give them sort of an expert opinion based on, can I dope this using what little technology we have available. Would I have been able to dope this, yes or no?
I suppose you also see, because of, as you were saying, in terms of access to care, probably much more tertiary disease than you would, not just obstetric tertiary disease, but all sorts of tertiary disease.
Yes, I would say so. In that we saw, well, if you're taking tertiary disease and meaning mature disease, so it's gone through the phases of when you should have perhaps had prophylaxis or preventative medicine. It's matured to the point where it's actually now having systemic illness. Absolutely. Third world will always see that. I mean, it's why South Africa should probably be leading the way for research in terms of HIV, in terms of preeclampsia, because we've got the academics, we've got the disease. The only problem is getting the money. I mean, if you look at Professor Bruce Bickard in KZN, he's doing fantastic work, or wants to do fantastic work, on HIV and anesthesia, totally unrelated to obstetrics, but it's simply a challenge of government funding for research is just not going to happen. Private funding is always difficult to obtain. There's always ethical questions associated with it. And I think that's sometimes where we need to maybe look at the collaboration between places like Stanford and South African universities, where you have the funds, you have the right research questions, we've got the patients for you to answer the question.
That was truly fascinating. Thank you so much for taking the time to talk with me today.
Thank you very much.
I'm Dr. Janak Chandrasoma from the Stanford Anesthesia, Informatics, and Media Lab, signing off.